Welcome to NEET-PG 2024 recall questions, third video. A patient in ICU and due to prolonged stay in the hospital, he was started on TPN, total parenteral nutrition. What is the most common complication of TPN, total parenteral nutrition? Probably metabolic complication was asked, and all the options were maybe from metabolic, and the options were like hypoglycemia, hyperglycemia, or race transaminase enzyme. So the answer will be hyperglycemia. So the answer is hyperglycemia. Hyperglycemia is the most common metabolic complications of TPN. Question number 22. Lung carcinoma patient, histopathology image was given. So this histopathological image was given and ISC was TTF1 positive. So this is lipidic pattern of histopathology with ISC TTF1 positive. This clearly suggestive of lung adenocarcinoma. So this is adenocarcinoma lung. Question number 23. A 20-year-old football player during playing football there was sudden onset unconsciousness. Then some of his colleague tried to resuscitate but failed. So 21-year football player, sudden onset unconsciousness, probably sudden cardiac death, resuscitation failed, and on autopsy histopathological finding was this. So this is helter-skelter appearance of cardiac muscle. So this is helter-skelter appearance of cardiac muscle. This cardiac array, typical helter-skelter appearance or cardiac disarray, is suggestive of nothing but hypertrophic cardiomyopathy. So this is young male patient with sudden cardiac death during playing football, biopsy showing helter-skelter appearance. This is hypertrophic cardiomyopathy. In most of the cases, family history of sudden cardiac death is also present. Coming to question number 24, 2-day-old boy failed to pass. There was history of failure to pass meconium, and there was distended abdomen. And diagnosed as a case of Hirschsprung disease. And the question asks, congenital absence of neuron in which layer causes this pathology, means Hirschsprung disease. I think one image was given and the layer was marked like this layer is mucosa, this layer is submucosa, this layer is muscularis layer, and this is serosal layer. So as all of you know, Hirschsprung disease is due to absence of ganglion cell layer in two regions. One is in submucosa, that is Meissner plexus, and in the muscularis layer there is muscularis in the musculi, and another plexus is in the muscularis layer. So myenteric plexus. So these two plexus, Meissner's and myenteric plexus, absence of ganglion cell causes this disease, Hirschsprung disease. And the boy failed to pass meconium for this disease. So the answer will be 2 and 3, layer 2 and 3, means submucosa and muscularis layer. Absence of ganglion cell layer plexus in submucosa and muscularis layer causes Hirschsprung disease. Question number 25, straightforward image-based question. This was nothing but nasopharyngeal airway. This is not ET tube or endotracheal tube, or this is not also Goodell's airway. So this is nasopharyngeal airway. Next, coming to thyroid gland specimen image. So this was the image, and this is typical orphan ani nuclei image. So I think all of you are aware of this image, orphan ani nuclei pattern. So this orphan ani nuclei pattern was there. So this is suggestive of papillary thyroid carcinoma or papillary carcinoma of thyroid. And the question asks, which gene mutation is most common? So papillary thyroid carcinoma with orphan ani nuclei, the most common gene mutation is BRF V600. So BRAF V600. Next is Kanagawa phenomena is shown by. I think the question was slightly lengthy but I have made it very simple one-liner. So this Kanagawa phenomena is shown by Vibrio parahemolyticus. This is again straightforward image based question. Here you can see one swelling is there in the limbal region of child eye. So this is nothing but limbal dermoid. I think this is direct repeat from past year question. This question was repeated 1 or 2 year prior to this NEET-PG. So this is nothing but limbal dermoid. Question number 29, deficiency of which of the following leads to pan-acinar emphysema? This is also straightforward factual question. So this is alpha-1 antitrypsin deficiency, because alpha-1 antitrypsin is having anti-elastase property. When there is deficiency of this alpha-1 antitrypsin, then there is decrease anti-elastase activity, rather there is more elastase activity, more destruction of lung parenchyma and fibrosis that causes emphysema. Ultimately, this enzyme deficiency results in pan-acinar emphysema. Coming to question number 30, a elderly female with recurrent urinary incontinence and dementia will benefit from which of the following pharmacological treatment? So this is straightforward question from pharmacology, urinary incontinence. So in this case the answer should be tolterodine. This is muscarinic blocker M1, the rest is M3. So basically this muscarinic blocker tolterodine used for urinary incontinence. Okay, so this is directly from pharmacology anti-muscarinic segment. So in the next video I am going to discuss question number 31 to 40. So please suggest the recall question in the comment section and don't forget to subscribe my channel and share the video. Thank you very much for your attention.